Every October, I see the same Medicare mistakes happen over and over. People assume their plan hasn't changed. They wait until December 6th to review it. They don't compare new options, and these mistakes cost them hundreds in extra premiums and copays. Today, I'm breaking down the top 3 Medicare mistakes during annual enrollment and exactly how to avoid them. If you're new here, I'm Adrienne, a licensed Medicare agent, and my goal is to make Medicare simple and clear. If you want Medicare tips like this every Tuesday and Friday, hit that subscribe button right now so you can make confident Medicare decisions and skip the confusion. Before we talk about the mistakes, let's quickly review what annual enrollment or AEP actually is. AEP runs from October 15th through December 7th every year. During this time, you can make changes to your Medicare Advantage or Part D prescription drug plan. It's not connected to Medicare supplement plans, also known as Medigap. You can apply for a supplement plan any time of the year, but if you're outside your open enrollment window, you might have to answer health questions for approval. That's the key difference. So when we talk about AEP, we're focusing on Advantage and drug plans, not supplements. The biggest mistake I see is people not reviewing their current plan. Every fall, your plan sends you an annual notice of change. That's where they list what's changing for the next year. It could be your premium, deductible, or copay amounts. It could even be your drug formulary, meaning a medication you take today might move to a higher cost tier next year. Your pharmacy or your preferred network could change too. If you don't review those details, you might start the new year paying more out of pocket without even realizing it. I tell my clients, even if you like your plan, review it. It takes less than 30 minutes and you can save hundreds and a lot of frustration. If you're not sure how to compare, my free Medicare Starter Kit includes a checklist for that exact step. You can grab the link in the description. The second mistake is waiting until the last minute. Every year, I get calls during the first week of December from people trying to make last-second changes. By that point, the phone lines are busy, agents are booked, and there's no time left to compare properly. Remember, the December 7th deadline is firm. Once it passes, you're locked in for the year unless you qualify for a special enrollment. I'll discuss that in a later video. I always recommend completing your plan review and any changes before Thanksgiving. That gives you plenty of time to double check your doctors, your medications, and your premiums without rushing or stressing about deadlines. Here's my perspective after years of watching people go through annual enrollment. The biggest misconception is that Medicare plans are stable. They're not. Every fall, carriers adjust their benefits and networks. Sometimes the plan name and premiums stay the same, so people assume nothing changed. But inside, the drug list or the copay structure can shift completely. By January, they're shocked their prescription costs doubled or that their doctor is no longer in network. That's the part most people don't see. Plans are designed to stay competitive, and those changes happen quietly. So the smartest Medicare members aren't the ones who memorize every detail. They're the ones who review, verify, and adapt early. That's what keeps them ahead every single year. The third mistake is assuming all plans are the same. Just because 2 Medicare Advantage plans have the same premium doesn't mean they have the same benefits. One might include better dental, vision, or hearing coverage, while another may have stronger drug coverage. The same goes for supplement plans. Every Plan G covers the same benefits, but the monthly premium and the rate history can vary a lot by company. Before you re-enroll into a Part D or Medicare Advantage plan or even switch, look at the full summary of benefits, not just the price. Another big one, don't rely on TV commercials or mailers to make your decision. You've probably seen ads saying you could get $2,000 in dental coverage or plans with a $0 monthly premium. What they don't tell you is that those benefits only apply in certain areas or sometimes only for specific health or income situations. Always read the fine print and verify with a trusted source, family member, or an agent before you make changes. The goal of AEP is to get coverage that fits you, not what looks good in the commercial. So let's bring this all together. How do you actually avoid these mistakes? It's simple. Review your plan in October, compare before December, and double check your prescriptions and doctors every year. Last year, I spoke with someone who was shocked to learn their primary care doctor had left their network. And they didn't find out until the first January appointment. They had to pay the full cost out of pocket for that visit. That's the kind of surprise you can prevent by reviewing early. A few minutes of checking in the fall can save hours of frustration and unexpected bills later. The more proactive you are before the deadline, the smoother your entire year goes. And before we wrap this up, here's what I really want you to take away from this video. Don't skip your plan review. Don't wait until the last week. And don't assume all plans are the same. Start early, compare carefully, and stay informed. If you like a simple guide to help you review your plan, you'll find the Medicare Starter Kit linked in the description. If you found this helpful, subscribe for more Medicare videos every Tuesday and Friday. Thanks for watching. I'll see you in the next one.